Unit 6, General Instructions for Formula Administration by Feeding Tube. When administering formula through a feeding tube, always follow the delegating licensed nurse's instructions and your agency's standard policies. When administering enteral nutrition, direct infusion of liquid nutrition into the stomach or small intestine. Never administer formula through any tubes or access port other than the enteral feeding tube or port. You must make certain to correctly identify the feeding port. Remember, tube feeding that is continuous, gravity, or pump will need to be turned off and tube flushed with water prior to administering medication via the same feeding tube port. The delegating licensed nurse will provide you with instructions on how to do this. To administer formula. 1. Follow general preparation guidelines, including positioning of the individual and verification of tube placement. 2. The delegating licensed nurse will provide specific instruction for positioning of an individual and how to verify tube placement for an individual. 3. Follow the guidelines for the general preparation for administering food per feeding tube. There are 4 different methods of administering feeding tube formulas. The method of food administration will be prescribed by the physician and delegated by the delegating licensed nurse. The 3 most common methods are described and include syringe bolus tube feeding, intermittent gravity tube feeding, continuous gravity tube feeding, pump tube feeding. Note: do not use hot water and do not heat water in microwave, on a stove, or over fire. Check temperature of water by placing a few drops on the underside of your wrist. If it feels hot on your skin, it is too hot to use. Water and formula should be at room temperature prior to administration. Methods of administering feeding tube formulas. 1. Syringe bolus tube feeding. The delegating licensed nurse will provide the DD personnel with specific intermittent tube feeding instructions. These instructions should include formula, amount of each feeding, number of feedings each day, duration, times of the feedings, tube flushes, amount of water before and after feeding. 1. Follow general preparation guidelines. 2. Clean the work area, wash hands thoroughly, and put on gloves. 3. Assemble equipment you will need: formula, water, measuring cup, 50 to 60 cubic centimeters syringe that fits the tip of the feeding tube. Allow formula to warm to room temperature over 20 to 40 minutes if it has been refrigerated. 4. Explain procedure to consumer. Provide privacy. 5. Position the individual as instructed by the delegating nurse. 6. Verify tube placement per delegating licensed nurse instructions, for example, by checking for tube graduation mark position, injecting air into the tube with the syringe and listening for air bubbles in the stomach with a stethoscope, by aspirating, pulling back on the syringe to check for stomach contents. 7. Remove the plunger from the barrel of the syringe. Clamp the tube with fingers to prevent reflux of stomach contents into and possibly out of the tube. 8. Place the tip of the syringe in the end of the feeding tube. 9. Pour the prescribed amount of warm tepid tap water into the syringe, usually 15 to 20 cubic centimeters. 10. After the water has gone through the tube, slowly pour the prescribed amount of formula into the syringe. 11. Allow the formula to flow into the tube by gravity. The higher you hold the syringe, the faster the formula will flow. 12. Repeat until all the prescribed amount of formula has been given. You may need to clamp the tube with fingers as you refill the syringe to prevent reflux of stomach contents into and possibly out of the tube. 13. Pour the prescribed amount of water into the syringe to cleanse the feeding tube. 14. After the water has gone through the tube, clamp the tube and remove the syringe from the tube. 15. Remove gloves and wash hands thoroughly. 16. Wash the syringe with small amount of dishwashing soap and water. Rinse thoroughly to remove soap film. 17. Wash hands again. 18. Document procedure by following your agency's policy and procedure for documentation, or the delegating licensed nurse's instructions for documentation, which may include the following. Verified placement per nursing delegation. Color and amount of fluid aspirated and replaced. Type of feeding and amount given. Consumer's response to the procedure. Aspiration of stomach contents to validate tube placement differs from checking for amount of residual in stomach at a specified time. When aspirating stomach contents to verify tube placement, only withdraw the amount needed to evaluate the nature of the aspirate, color, odor. Does it look like stomach contents? Once you have verified the tube is in the stomach, return the small amount of aspirate to the stomach, flush the tube, and proceed with medicating or feeding the client. If prescribed, the stomach contents may be checked for amount of residual content at a specified time after a feeding to determine if the stomach is emptying properly and the client's body is using the food instilled. In a healthy person, there should be less than 50 cubic centimeters of residual left in the stomach several hours after eating. The delegating licensed nurse will tell you the amount of the residual to report immediately. A good rule of thumb is a residual of 50 cubic centimeters or greater should be reported directly to the nurse. If the residual amount is more than what the nurse has told you is acceptable, do not put any food or medication in the feeding tube and notify the delegating licensed nurse immediately. Return residual to stomach if instructed to do so by the delegating nurse.